Okay, so good morning, everyone. I, Dr. Shrishti Shetty, and it's my deep pleasure to welcome all the participants of today's session and family members of our Swara Gurukul. I welcome you all to this 100th session of SODP, that is Swara Online Discussion Portal, an initiative of Swara Gurukul by Dr. Chandrasekhar Algungi. I thank Sir for this platform as it reflects continued commitment and structured discussion and Hanuman learning. Before we proceed further on this milestone of the 100th session, let us reaffirm the principles that guide our practice. So I request everyone to repeat after me wherever you are sitting the Hanumanan oath. On my honor, I swear that I shall practice the teachings of homeopathy, perform my duty, render justice to my patients, and help the sick whosoever comes to me for treatment. May the teachings of Master Hanuman inspire me, and may I have the strength for fulfillment of my mission. At this moment, I'd like to speak about the larger academic vision behind everything, behind this platform, that is Swara Homeo Gurukul. The dream and vision of one man, Dr. Chandrasekhar Algungi. Swara Gurukul is a 7-day workshop which encourages deep learning and holistic food and living. It includes many activities which will begin with just simple welcoming our participants, which is done traditionally with an arti and a tika. Also, daily morning yoga sessions, as a disciplined mind strengthens clinical judgment and deepens our capacity to heal. Followed by, we have open classrooms, which reflects the true Gurukul tradition where learning happens through direct interaction and shared experiences, which is a beautiful something to experience. And also, we have quiz competition, which challenges our intellect for better learning process. Followed, we also have activities like group discussions. So there are many groups made like Hanuman group, Ken group, Fata group, and many as so what happens? A video lecture is shown to us. A case video is shown. So when you individually understand the case first, and then you sit in a group, you sit as a group and give your own points and discuss among the group. So what advantage here happens is when you see or understand a case by yourself, you understand only through your perspective and through whatever understanding you may have. But when you sit in a group, you understand what other way you could see this case. And the learning that happens here is amazing and beautiful. So in the groups that are made, there are different age groups, like seasoned practitioners to newcomers to beginners to people interns to people having practice of 2 3 years, people about to start their practice, and everyone in between. So the discussion that happens comes from every perspective, from the experience, from having no pre-assumed thoughts. So the discussion happens is beautiful. So followed by this, we have debate sessions, which happens in a beautiful lawn where everyone sits together in their groups and the discussion starts. And the discussions and the debate is very competitive and yet friendly. So again, in this, when groups are sitting together, the minute differences, why it could go to this miasm and not that, why it could go to this remedy and not that. The minor differences that come in the debate sessions that you see is amazing. Followed by case presentation, where everyone presents a case and put their learnings, put their teachings from the Gurukul into the practice, and to see such amazing cases is beautiful. Followed by the scholarship test in the memory of late Dr. S.S. Algungi. The intent is to help students to continue their learning. So similarly, we have upcoming Gurukul that will be having on Super Class 4, that is from 8th to 14th March. It will include remedies having themes home, money, future, family, education, and settled life. This, if you understand, it will include a big chunk of population. So we dive deep into the superclass 4. So in this superclass 4, sir is also going to include grammar in homeopathy, which is the latest concept to make case taking even easier and I could say structured. So also dynamic words. Many people might have attended its module, and people who haven't, what dynamic words to mean. Now, just take an example of this superclass 4 theme, money. So for everyone, now many people would speak about money, but for everyone, it could mean different. Like for someone, like for me, money could be security. If I ask someone else, what is money for you? They could tell money gives them respect, money gives them position. So yes, these are the dynamic words where the case starts and where the core of the case you understand, and it gives you a very structured case taking understanding. So this is also what sir is going to take in this March Gurukul. And also he himself is going to take a case. There will be a live case by Dr. Chandrasekhar Algungi, and it is something to be witnessed. So as a beginner, if I could tell to people who haven't attended or wish to attend, I could just tell, just give it a shot and try, because once it is homeopathy 24/7. You are in such beautiful environment, you do not understand how much you are learning in those 7 days. For me, before even starting the session, I was speaking to the practitioners who've been practicing since many years and listening to their experiences. It was just beautiful. Even the before the session could begin, and that was such great learning for me for 7 days. And I actually understood it when I came back and started seeing cases, how different my approach and understanding was towards the cases. So yes, for any beginners or anyone who's still thinking, should I or should I not, I would just request them to give it a shot, and then it's up to you. Okay, now, so what is the purpose behind this Gurukul? That is what we are speaking, continued learning, which becomes so important even for a seasoned practitioners. So we see many teachers opt for teaching in colleges. What is the reason? To keep in touch with the subjects, for continued learning, to feel the process and to feel in with the generation. So this is exactly what happens in Gurukul. You are in touch with the subject. You having that, the learning spirit high. You keep having these discussions, debates, and it is a must attend session. So through Gurukul, you can also get a lifetime subscription to our continuous learning portals, that is SODP. So it is a collaborative platform to share clinical insights, discuss complex cases, enhance clinical expertise, grow together as supportive homeopathic community. So SODP, what happens is after you attend Gurukul, in every 15 days, there is this discussion portal. You see a case, you ask your questions, you hear your doubts. So you learn something, and then in every 15 days, there's discussion about it. And every 15 days, you are seeing a case about it. So you are in touch with the topic and discussion and the method throughout the process. And that is not for a few months, it is a lifetime subscription. So the aim is to is a continuous learning, sharing, and refining the clinical skills in tandem with the application of knowledge gathered at the workshop, as I said. So after Gurukul also, you can keep learning, keep the learning spirit high. You can keep in touch with the topic and discussion, and all for the learners whose learning spirit never drops. These are totally free sessions to all the Gurukul members. With the same energy and spirit, today we move forward to the 100th session of this SODP. And this itself is a great milestone. This wouldn't have possible without all the practitioners that come together to learn, and all the teachers who take their precious time out for us. Now, as we reach to the 100th SODP, there are so many topics covered, like coming from cases, experiences, learning, understanding basic aphorisms that we learn in college, learn case taking better, from families to roles, everything in between. And I am very delighted and happy to attend these sessions from wherever possible. So moving forward, so this is the dates of SODP sessions that has been scheduled for the entire year 2026 from 3:30 to 5. So we have the upcoming months, as you can see. Also, yes, we have different practitioners who will be teaching and giving their cases and making discussion with them and understanding with them. So also, like SODP, which is a learning portal, so it also runs many other initiatives. Like coming to this, Man on Mission. The mission is to highlight the efficacy of science and art of homeopathy among young budding homeopaths, as well as the wider society, as a part of an awareness initiative. It seeks to inspire confidence, understanding, and informed acceptance of homeopathy through education and meaningful engagement. So this year we are in collaboration with the 5 colleges. So in this, the sessions are for all the students and homeopaths, the budding homeopaths. So they understand what actual homeopathy is and not just the theory, how to put it into practice. And all these speakers come together from starting with January 17th to 19th of December. The whole thing is scheduled, and all these practitioners come together and give their teachings and are speakers who are leading this mission to success. Also, there are many different initiatives going on in Ahmedabad, Vijayawada, Andhra Pradesh, Hyderabad, Salem, Tamil Nadu, like GCTs, guided case takings, where the practitioners who's learning could be seasoned practitioner or a beginner, and he takes case in front of all and sir, and it happens in sessions like half an hour, half an hour, half an hour, where the case doesn't go any forward. So you understand and get the learnings directly from the sir, that where you went wrong and what you could have done in this and where you could should have been persistent. So it's a beautiful learning, and also live case takings I saw, and module series that happened in Ahmedabad. Recent was a dynamic series, as I said. The book, the masterpiece, case taking, the art of connection, communication, and conversation. We learn the formula of P's and W's. If people don't know, you should read the book. And this is important because when you ask the patient the right question at the right time, you don't need to go and search for the which is this remedy. The patient itself takes you there, and like we have seen those cases where it feels like the patient knows what is the remedy, and the patient speaks that. And that is not something magic, that is just the beautiful process of the art of case taking, where sir has explained it everything in detail, which as I was telling, the formulas of P's and W's. You put this formula and get a structured case taking, and you understand how to move forward. So sir has also given cases in the book, which you can go through and understand how his thinking and idea goes behind the case taking, and also the discussion and understanding of each case and how he has procedure is also written. It's a very beautiful case, and for uh, people who have not read the book and are thinking that how is that even possible that the patient is speaking the remedy, so I suggest them to once read this book and master the skill of communication. Coming to the video lectures are also available, where various topics sir explains in each topic with extreme depth and easy understanding. There are lectures on various topics like mammal series, snake series, bird series, kingdom differentiation, mineral kingdom, behind the scenes, secrets of case taking, salt series, levels of experience, delusion, and beyond. So all these video lectures are available. So whoever interested can opt for it. Yes, so now we also have our YouTube channel, Instagram. Coming to the YouTube channel, where we have videos, educational videos, and guidance for everyone or whoever needed everything on that YouTube channel. There are playlists present there. where each subject can be understood in depth from all the lecturers, from everyone. Where that's why the playlists are made, so you can opt for each, and also available in many different languages: Tamil, Telugu, Hindi, Marathi, English. So you can opt for the language that you are comfortable with. And also Instagram, where you understand or where the Swara team updates where the next session is going to be, next module is going to be, next GCT, next webinar. So you can stay in touch and attend all the sessions with us. So also, if you have any doubt, you can message anywhere in the given websites. And so if you want to inquire anything related to Gurukul, SODP, Man on Mission, modules, GCT, if you wanted your city, or about any of the educational videos, how you can get them, or the book, you can contact us through these websites and phone number. You can scan through it. Okay, that's all from my side. I thank everyone for patiently listening to me. So I hope everyone is as excited as me to listen to all the case presentation. So yes, to you, Bhanu sir. Thank you, everyone.
Thank you, Srushti. It was a great introduction. It was a whole visual journey of Dr. Shekhar sir, his vision, his mission about right from Gurukul, all the activities, offline, online, GCTs, S4DPs, everything was beautifully introduced. And now today we go into our today's event, that is S4DP. So it was a huge milestone. So conducting this, celebrating this centenary celebrations. So if you are reaching to silver jubilee, it's a great, we think. Now it has crossed golden jubilee, diamond jubilees, and now centenary celebrations. It was a huge milestones. So it is because of the purpose, the intent of sir, which leaded this to hundreds S4DP session. So it is a Swara online discussion portal organized by Swara Homeo Gurukul. The originator, the Chandrasekhar V. Algungi sir. The purpose behind this S4DP session is the Swara online discussion portal is a monthly academic platform created to ensure continuous clinical learning beyond workshops and to support homeopathic doctors in their real life practice. The core objectives are continuity of learning, to keep the Gurukul learning active between two workshops and help the participants regularly revise and apply the concept in practice. And also clinical application support through this S4DP, like doctors can discuss their difficulties faced while applying homeopathic principles in their daily cases and receive guided solutions directly from sir. And case-based learning, participants present challenging or failed cases and analyze step by step where improvement is needed through collective discussions. So many discussions happens. There is a chance to uh, produce through your class. You can learn from these S4DP sessions, and there is a peer and mentor interactions. This creates a space where learners interact with teachers and fellow practitioners, promoting collaborative clinical reasoning and deeper understanding. So this was a unique way where every practitioner come and discuss their case and we learn together in this S4DP portal. And professional growth monitoring. Faculty maintain close academic connections with participants, helping them grow not only as a homeopath but also as a confident clinicians. So n number of doctors have growth with this portal, with this after association with the Swara Homeo Gurukul. So simply, if I want to say in one line, it is a platform where learning continues, cases evolve, and homeopaths grow together. So this is a 100 Swara online discussion portal. We are celebrating this session with this competition of case presentation competition. The main purpose behind this competition is to increase the scientific homeopathic prescribing, to promote classical individualization, to improve clinical reasoning and analytical skills, to share evidence based clinical experiences among homeopathy practitioners. This contest is designed to strengthen reasoning, remedy differentiation, and clinical convictions among homeopaths. So, in this competition, there are two category groups we are selected. So, first category is the practitioners who are experience of 5 years of practice, and category 2 is the practitioners who have more than 5 years of experience in their clinical practice. So in this, the winners are given with, in each category, one winner from each category will be awarded a 10% discount for the March 2026 Swara Homeo Gurukul workshop. So the total timing for each presenter is 10 minutes. Warning bell is ranked at 2 minutes remaining. So this has to be keep in mind whoever is presenting their cases. So when we have announced the case presentation competition, n number of cases, their abstract were came to us. So out of that, we have selected these cases, and I congratulate each and everyone for this competition you have selected. Now we are ready to listen to your cases. So before that, I will show that order of presentation, because to know when they are able to present their case. So this is category 1, Dr. Hemanth. After that, Dr. Manikanta, Dr. Sandhiya, Dr. Manikanta. B, Dr. Vritti Kankotia, Dr. Gayatri Gondale, Dr. Dipikaben Palmar, Dr. Gowtham, Dr. Amruta Manoharan, Dr. Dhruvin, Dr. Vinay Kumar. This is a sequence runs throughout this event in category 1, and whereas in category 2, Dr. Arvinda, Dr. Anand Desai, Dr. Meera Javeri, Dr. Asis Saparia, Dr. Tarasuba, Dr. Kirti Mutreja, Dr. Kamlesh Kagde, Dr. Sudhir Patil. So this is a sequence which goes in this category 2. So remember this category and be ready for your presentation. So today you are not just a presenter, you are a contributor to the growth of classical homeopathy. Each case you present is a step towards strengthening evidence-based homeopathic practice. We warmly welcome all the passionate homeopaths who have gathered here to present, learn, and inspire. With this, I welcome our first presenter, Dr. Hemanth Nagula. He is from Tirupati, Andhra Pradesh. Years of practice, 4 years. He had completed BHMS from BD Jetty Homeopathic Medical College, Dharwad, in September 2022 and started practice at his own clinic from November 2022, Rajampet near Tirupati. Currently pursuing the diploma in diet and nutrition education from IGNO. Started attending Swara Homeo Gurukul International Workshop since March 2025 at regular intervals, which shaped has a better one personally and professionally. So I welcome you, Dr. Hemanth.
Thank you, sir. Thank you so much.
Now you can share your screen.
Yeah. Good morning, everybody. This is Dr. Hemanth, and I hail from Tirupati. Today I am presenting a case. Here is a patient of name Renu, who is 24 years old, and by occupation she is a nurse, and she is married for 3 years. In her history, there was irregular menstrual cycles since the past 3 years, and she was already been diagnosed with primary infertility with bilateral PCOD and suggested to go for laparoscopy PCOD drilling. But she came to me, she went to another homeopath who has given her many remedies. But being her mother being under my treatment shows, and also because of the trust and hope of homeopathic medications, she came to me with these complaints of irregular menses since past 3 years. Menses appear only once for every 3 to 4 months. And during these menses, there is heavy backache. And when there is no menses for 2-3 months, and these menses were replaced by leukorrhea, which is burning in very severely. And along with that, there is hair fall and there is weight gain and there is soreness of both mammae, which is tender to touch, and excessive perspiration during night all over the body. It's like, and by nature, she really craves for sweets, pastries, chocolates, and seasonal mangoes. And she is very sensitive, mild, and introverted. Even during my consultation, also, it was very much difficult for me to let her tell all the symptoms, that much introverted and mild she is. Even her sensitiveness also, she kept on telling in her narration that she is not able to even able to see the non-vegetarian being cutted before cooking. So that much sensitive she was, and she is very much obsessed with religion. And there is suspiciousness in her regarding that something may happen to me or my loved ones, and this suspicious may cause intense fear in her. And this fear, and during this fear, she needs somebody to give her a shoulder. And whenever somebody hurts her, during that hurting situation also, she used to go near to God and pray to Him with weeping only. Continuously weeps and she prays. That much obsessed with her religion and that much fear and desire to have someone near to her. And there is also, and she is also very affectionate towards her family, and she likes children. Even in my consultation, also when she was waiting outside my waiting in the waiting hall, there is one boy, and she has taken him to her, and I was watching it in CCTV, and she was kissing him, cuddling him. She is carrying him. She is going outside, and she is giving him some chocolates. That much liking towards children is there. And also there is fear of ghost and being alone. So I thought of reconfirming the diagnosis which she came with, and in that it was shown that right ovary measuring 4 into 2.3 centimeter, left ovary 4.4 into 2.3 centimeter, with having multiple immature follicles arranged peripherally with central echogenic stroma. And the impression it was shown like bilateral bulky polycystic ovaries, which the modern medications they have suggested her to go for this PCOD drilling. Next slide. This totality of irregular menses, no, previous one. Backache during menses. Menses are replaced by leukorrhea, and which is painful and staining, very much staining to undergarments. Soreness of mammae, desire for consolation, desire for sweets, chocolates, and mangoes. Religiousness, suspicious about future, obsessed with kids, fear of ghosts, and being alone. So I have considered these symptoms for totality, and depending on this totality, I have made some repertorization, and I have considered these rubrics. Next slide. And it shows like mind affectionate, kisses and cares as children, mind consolation, amelioration, fear, ghost of night, religious affection to fanatism, mind timidity, bashful. She also had hate fall, especially at the vertex region, and leukorrhea instead of menses, female, and menses long and variable intervals. Sexual desire increased with leukorrhea, chest pain, mammae, sore, pain, menses, back pain, menses during aggravation, perspiration, profuse generals, these mangoes desire and pastries desire. So the remedies which I have got are Pozzarella, phosphorus, sulfur, silicia, lycopodium, china, and all. So many of my friends before she came to me, she was taking medicines from my colleague only, who has given her lycopodium, stephysagria, phosphorus, almost all these remedies she has tried, but there is no much improvement. And also, next slide. It is not the fact that Pulstil has covered almost all the symptoms and has the best degree comparing to the other remedies. But next slide. During her life space investigation, especially in the family, profession, and married life, due to this time constraint, I can't able to express all the symptoms which he has told me during the narration. But in almost all the parts of her narration, acceptance avoidance is seen, which is the core theme of psychotic nasm. If I in a gist I want to, if I ask you to say, in family area also, next slide. In family area also, whenever there is a arguments or discussions regarding anything seriously going on, She immediately goes back to her room and she locks the door. Till the conversation or the झगड़ा जब तक खत्म होता है तब तक वो बाहर नहीं आती है. Simply she goes inside and locks inside the room only. In profession also, whenever there is heavy work, by profession she is a nurse. Whenever there is heavy work in her ward or in her clinic, hospital, she used to give that work to other person because she is having the fear of getting scoldings, and these scoldings affects her so much that she used to avoid that work and give it to her colleague. That much avoidance. And and in married life also, whenever there is discussions or anything, any small fight also with her husband, she comes back to her parents home only, from in-laws home. Till the things get settled, she don't go back. So in the gist I have told this, but in broad spectrum I have seen acceptance and avoidance in all the parts of her life story, which is the core theme of psychotic miasm. As been Pulsatilla covered all the symptoms, and also this it is been the psychotic miasm. I have prescribed her, next slide, Pulsatilla 200, which is given for weekly one dose for a month, along with Saclac twice a day for 30 days. And also, as PCOD has been the this thing, we have to give tell her the diet and moderate exercise, as it is a lifestyle disorder. So I have advised her for diet and moderate exercises. During her first follow-up, that is 25th December 2024, she came up with menses appeared nearly after 2 months taking after Pulsatilla, but still the bleeding was scanty, which she said that it is still spotting, not that severe bleeding. And there is leukorrhea leukorrhea which is slightly reduced and not painful as before. But there is no other change in other symptoms, like there is hair fall, there is the tenderness of mammary. In those symptoms, there is no change. So, as her major sufferings are being reduced by Pulsatilla, I thought of repeating the Pulsatilla again for in the same manner, like 200 weekly one dose for 1 month, along with Saclac twice a day for 30 days. During her second follow-up on 20th January 2025, she came back with menses became normal, where the flow is for 3 days, and backache is significantly relieved, hair fall reduced remarkably, soreness of mammary is also decreased, which is better than before. So the Pulsatilla is working on her very good in nice way. So I thought repeating the Pulsatilla without changing any potency or remedy. So I have given her the same remedy, which is Pulsatilla 200 weekly one dose for 1 month, along with Saclac for 30 days. And when she came back for the third follow-up, which is on 31st March, there is significant improvement, which you all can see. Menses have become normal like before 3 years. How the menses were before 3 years, like that there is reappearance in a healthy way, where the flow is for 4 days without any clots, and soreness of mammary is completely reduced, where the hair fall is also improved. So I thought I want to check how the ovaries are there, how much the Pulsatilla has been effectively worked on her. So I thought of advising to go for USG abdomen and pelvis during the third follow-up, and the report has come like it shows like bilateral ovaries visualized and normal, and
Time
there is
up.
no significant abnormality.
Hemanth, time is up.
Can I take 2 more minutes?
We are running out.
Can I take 2 more minutes?
No,
Yeah,
we
sir,
are
still
running
you
out
have.
of time. So as early as possible, finish it.
Yeah. Next slide. So, as the cause for her infertility has been recovered, so I advised her to go have intercourse during the ovulation period and to get conceived. So, next slide. In fourth follow-up also, there was no irregularity of menses. There is general well-being of the patient is observed. So, as being the cause is removed, there is a high chances to get conceived. So, I thought without repeating any medicine, the Pulsatilla, its work has been completed. So, let's wait and watch, and let's see how far it is gone like that. And when she came back with the next thing, next slide, and the report shows early intrauterine gestational sac corresponding to 5 weeks, 3 days of gestational, which shows she's 1 month pregnancy has been occurring. So this is what homeopathy has brought into her life. After 9 months of next slide, after 9 months of healthy pregnancy without any complications during those 9 months, she has next slide. She has given birth to a baby. she has given birth to a baby boy without any pregnancy complications. So as the patient herself was telling that ये बच्चे ने मेरे को भगवान नहीं दिया, ये बच्चे ने मेरे को होम्योपैथी दिया है. Like that she's told, which motivated me like anything, being a budding practitioner. So I thought this would motivate you people also. So I would like to say homeopathy not only cures but also creates the life too. Next slide. The books referred are Boric Medica, Soul of Remedies by Rajan Shankaran, Miasms of New Millennium. And the major takeaway from this case is understanding the miasm. As she was being prescribed with Lycopodium staphysagra and all, which are all belonging to the Ranunculaceae family, particularly staphysagra. But the miasm part, which they have missed, I with being best guidance, I am under. So I have covered her psychotic miasm also. So I have able to give pulsatilla and simplify the case with basic understanding. Like when she called me for to get an appointment, I started to think infertility case is coming to me. Which remedy I have to give? Which remedy I have to go with? Like that, I was being in continuous thought. Even while taking case, also I was in that thought only. But if we start giving the basic understanding and simplify the case with basic minimum things, it will be treated. So thank you for giving me this opportunity, sir. Thank you, Shekhar sir, and the Swara Homeo Gurukul. Thank you.
Thank you, Dr. Hemanth. It was a great case. It is really wonderful, inspirational case, which has enlightened all of us with your all the analysis and every beautifully presented. Now we will go to second presenter. So I request everyone to maintain the time.
Morning, everyone. This is Dr. Manikanta. Today I am presenting presenting one small case.
Mani, 1 minute.
Yes, sir.
So today's second presenter is Dr. Manikanta Konakalla. He is from Elur, Andhra Pradesh. 4 years of experience of practice. He completed BHMS from BDJT Homeopathic Medical College, Dharwad. He is MD Medicine from Foster Development Homeopathic Medical College, Aurangabad, and MS Psychology from Jain University, Bangalore, and DNHE from IGNOU, Delhi. So I welcome Dr. Manikanta for you to present your case.
Thank you, sir. This is Dr. Manikanta. Today I am presenting one small case. It's very pleasure to present here in the 100th Sodp session. The patient name is of Kanakadurga, 43 years of age. She is an Anganwadi teacher. Patient presented with the complaints of right side in the lower abdomen since 3 months, on and off. And nature of pain, she had particularly mentioned that there is gradual increasing in the pain and gradually decreasing. And at the localized area where she is showing, she want to rub someone there and to give some pressure over that area. She is feeling some relaxation. And another one more complaint is headache at the region of vertex, and headache associated with the nausea. And along with this, because of the abdominal pain, she is experiencing sleeplessness. And in the past history, if you see, there is a recurrent episodes of typhoid fever since 2 years. Nearly 8 to 9 times she had encountered the typhoid fever. And hysterectomy 1 year back, and I asked reason for the hysterectomy. There will be irregular periods. There are irregular periods in the menses are very profuse. She belongs to a backward village area. So much of medical facility is not there at that area. That's why they went for the hysterectomy in the higher hospital. And based on the things what had happened to her and the symptoms, I had advised her to go for the USG abdomen and pelvis. There we had seen the right ovarian hemorrhagic cyst. The dimensions are 52 into 43 mm. It is peculiar post hysterectomy. It is happened to her. And one-to-one conversation with my patient. This is a very short span of 10 minutes now presentation time. That's why I had cut down the case. my conversation is with chief complaints only. She had started, and after completing the chief complaint, I initiated her some more. Like that, she took a long pause. Then she started. She only started saying about herself. Like everything is very normal before 3 years. That one incident changed my whole life. I asked her to explain the incident. Then she started without no, generally the patients will go for the incident and the emotions, but she want to just give a clarify for me initially. I am very perfect. I will do the things in a precise manner. I don't want to point out me anyone or any work done by me. Even my work have to be very perfect. I want to do this. Like in such a manner she had presented, and she had like appreciation. She want that appreciation, and I am such a perfect person that everyone will appreciate my work. Not only my work, even the way I wore my sari, everyone will appreciate that. Then I used to maintain that name in the society. All of a sudden, everything got changed. Then I asked her what is the thing what had happened to her. My son got married against my will, that is love marriage, where daughter-in-law is from the another caste. Then I started like poking her. What is in that? I want to know the true nature of her, what she is feeling inside. Then what is in that? I asked like what is in that? Because of that marriage, I lost my respect in the society. Even people who are work under me, or who are with the low level also, they are seeing me in a low. And I asked her how you feel in that situation. She said insulted. Then I asked her to describe that insulted. Then what she had explained, like she initially she started with some story, but I overlapped that thing and asked her only explain about insulted according to it. Then she had explained, I want to maintain a position and respect in the society that will be that had lost, and that efforts I did for to come this position. She is an Anganwadi teacher, means in that whole village area she have some respect in that area, and all the children whenever she is going outside they all will wish her. And she is like a head person, some of head person in that some families in that area. All that had lost. I had did a n number of things to them. I had to come to this position, but only that incident, the son married the girl from another caste, that only one thing had lost everything from her. And I asked her, she in the case she repeatedly explaining about the position and the respect thing. I asked her to describe the position and respect. Then also she started some stories only. Then I asked her, no, only like in Telugu, Gauravam. Explain that Gauravam. Then she said, there are the things I need. This is the things. This respect and the position are the two things I need in the life. Without the food also I can survive, not an issue. But the respect is very important. The position, to go that position, there is a very high position I had maintained. Even though I am just a small Anganwadi teacher, but my position, I feel it is like a hilltop. That is the words he had explained, and that what gives you that position. And in the if you be in that position, how you will feel. She used the word kick. Then I asked her describe that kick. At this time she laughed, and afterward she became some relaxed in the chair in front of me, and she go on explaining that will give me that maja, and if that kick is there I can do anything. She showing some gesture to, and she is explaining, for that kick I will do. If I am doing something, if I am trying to do something in the society, or else in the school area, in the family area, if that kick will come, that appreciation will come from that people, then I will do more and more and more. Then I asked her, why more and more? That appreciation gave me the kick. That is the word she said. And in the whole case, she had explained about the three areas: family, workplace, and son's marriage. In this case, I had observed the polarity of the single person, two things in the family and the workplace, and the opposite polarity in the son's marriage. How she feels, how she lost that. Even in the family and in the workplace also, she's like, I will do the things. I will do the things for my children. I will do the things for my daughter's marriage, gold arrangement, everything in the family. For what? I want to be precise. I want to be perfect. No one have to be point out me my work. If someone point out me, I will not leave. I will do that and I will correct that. I will prove them that their intentions are wrong. And even in the workplace also, she belongs to general normal teacher. She want appreciation from DEO, district educational officer. They have to appreciate me, and they are appreciating her because of her efforts. What she is showing, she had shown some photos also. I didn't believe that that is a Anganwadi school. Such a neatly, such a precisely, she had arranged everything. For what? For the thing she getting from the higher authorities. And all these things had lost because of the son's marriage. The respect is lost. The everything, everyone is seeing me with that low. That is the main polarity of these both sides. And in the family area, same. Even from the childhood onwards, I am such a person. Even in my schooling days, even in my family area, even in my family also, I will be keep everything in a correct manner. I will organize that 1 month before only. These February month, I want to purchase a dress for my daughter, and that dress, if she see the dress, she have to be like, my mama had given me such a beautiful dress. I want that kick. And even in the workplace too, she will treat all the children, all the parents of the children very nicely. And if they are saying, ma'am, you are very good, you are very good at place, you are treating us like a family, that appreciation give me the kick. For that appreciation, I can do anything. I can go. That appreciation will give me one more kick for to do one more thing like that. And the son's marriage affected me whole. Like that, everything is what collapsed. That respect, that position. Even now, if I don't want to do that, failure state had came up. And even in this totality, I had taken the rubrics, symptoms of feeling of 4 seconds, insulted, always want of appreciation, easily offended, pain at the region of lower abdomen, pain, emulation by pressure, tumors over right ovary. If from this position, respect, want to maintain that position in the society, we came up to the mineral kingdom. Of row 5, I want to achieve, appreciate. She's a developed person. I want to achieve, appreciate, and give to the people. That is of row 5 and column 10. I want that appreciation, and I want that pinnacle, like high position. I want to be in a high position. Everyone have to see and appreciate me. That is of column 10. The remedy is palladium. And even if we see the rubrics also, mind delusions 4 seconds, mind delusions insulted. His mind flattered, desired to be, mind longing for good opinion of others, mind offended easily, female genitalia, pain ovaries right side, female genitalia, pain ovaries, pressure emulation, tumors and cyst, female genitalia, tumors right side. The palladium is the remedy which is covering all the rubrics, both in the aspect of the sensation and both in the rubric point of view also. Palladium is the perfect remedy here. And I started giving palladium 200 weekly once 10 pills, and I followed by Saclec. Even in the first follow-up, the pain is reduced, but some episodes of fever are there.
Dr.
Like George Vitolka says at the end of a... Sir,
time is up.
Okay, sir, I will complete it once again. Like I continued with the palladium only in the water doses. After 3 months, there is no evidence of the hemorrhagic cyst, anything. And I had referred the William Borick Fatak and Clark book and Shankaran's are Solo of Remedies. Here, I want to mention why I present this case. This is the main thing, my clinical observation. Along with this case, I had treated the 17 cases of the hemorrhagic cyst. In all the cases, I had observed some similar pattern. Every patient in 17 cases, post hysterectomy only, these hemorrhagic cysts are occurring. The clinical observation and evidence are the two key role things we have to maintain in our clinical practice. This clinical observation will give me some more confidence and to cut short the case, where to precisely we can cut short the case, which area we have to concentrate. This clinical observation we will get from that. Thank you.
Thank you, Dr. Manikanta. So
Thank you, sir.
it was a great case. So now I think the purpose of this case presentation was very fruitful. By these two cases only, we have seen what homeopathy can be do in all the cases, in challenging cases. Thank you. So we will move to next presenter. Sandhya ma'am, you are ready?
Yes, sir, I'm ready.
Okay. Our next presenter is Dr. Sandhya J. She completed BHMS. She is from Salem, Tamil Nadu. Years of experience of practice is 3 years. Dr. Sandhya J is a young homeopathic practitioner committed to principles of classical homeopathy and sincere clinical practice. She has completed the Gurukul course under Dr. Rajan Shankaran, which has refined her understanding of deeper case taking and individualized prescribing. She also respectfully follows the teachings of Dr. Shekhar Algungi sir, striving to apply these insights with clarity and responsibility in her practice. At Adan Homeo Clinic, she focuses on thoughtful case evolution, constitutional treatment, and holistic patient care, with particular attention to chronic and long-standing conditions. So, with this, I welcome you, madam.
Thank you. My screen visible, sir?
Yes, yes.
Good morning, everyone. This is a chronic dermatological case of 55 years old female with chronic excematous dermatitis with secondary infection. She came with a complaint initially with continuous itching in the both foot, that is about for 2 years, and she sometimes feel the itching all over the body. And there is hyperpigmentation and cracked skin at foot and also the ankle. After the cracked skin had started for 2 days, she started getting oozing and pus formation, also with high grade fever, pain, and extreme tiredness due to some bacterial infection. This is her images. You can see the pus formation, oozing, and all the cracked skin hyperpigmentation in this image. This is very worse, and she was been suffering so much since years. This occurs in episodes. And her maintaining causes, she was working in a hotel, so she was long exposed to water due to detergents. That is aggravating her complaints. The itching is not at all the time, but whenever the episode comes, she gets very uncontrollable and violent itching that she couldn't stop. And she said that it may be not important at this time of initial cases. I used to hide my ankles because the eruptions will be visible with the dress. I feel very ashamed. And another complaint is sleep disturbance. She don't get enough sleep. 12 to 2 a.m. She wakes up with anxious thoughts about work, and as she is working in hotel, she start working at the time itself. Her thoughts that will be like people will think about me as shameful. How do I return to my native place with this disease? They might think that I got this eruptions and this extreme disease in the workplace. And her daughter's marriage, son's marriage is also a stress for her. She told that her daughter is not talking to her. She is not carrying her. She is not helping me in my work. So that is my very concern and worry. So if I get sick due to this eruptions or skin complaints, nobody will take care of me. This is what her trauma is. I wanted my daughter to talk to me in a jolly way, asking her needs, informing about her whereabouts, and how do I feel, asking about my health. These are her desires. She wants her daughter to ask her, talk to her. And her main stress is the same thing. People will question about me. They will tell she is not telling me anything. My daughter is not telling me anything, where I'm going or anything like that. So I am so dependent on them. I use the things they bought for me and I do all the work. I had been working since so much of years, but still she is not talking to me. She is telling about her daughter. She's not talking to me. She's taking revenge on me. Her main complaint is that it continues completely in my mind that she is not talking to me. Why is she behaving like this? She is behaving like my step daughter. Recently also I am sick for 2 days. I didn't wake up from my bed, but she didn't care even once. So this was her main thing, not being cared. She is not carrying me. My son cares me, but my daughter is not carrying me, not talking to me in a consoling manner, like a happy talk. Are you feeling well? Do you want to eat? Do you want anything? I wanted her to talk to me like that. So this is very difficult for me. Why I'm still in this difficult situation of not being in a happy place after all the hard work I have done, because she is 55 and she had been working since 20 years. So after all this I had done, why I'm still in a difficult place? And she also telling about son and daughter. Why are they not behaving like a close friends, not talking in a jolly way? So that is also her biggest problem. My daughter is not taking care of me. Who is going to take care of my daughter? She should take care of me, but that is not happening to me. So when this happens, nobody is there to tell me to take rest, to eat tablets, not to work, like talking happily. So this is her main concern. But whenever she have this thoughts or think about it, she started crying. Automatically, she started crying, and she said, "What to do? Can't do anything. I just need to accept it and move on to all the work. This is what I can do. It's not going to change at all." So in the same way, like the daughter, her husband is also not so much of talkative. He is also silent. He doesn't ask or share anything with her. That is also a problem. She's telling, "I'm still in a difficult situation. I need just the comfort." So what is the comfort? She's telling like comfort is like when nobody is asking me how are you feeling, what's happening with you, shall we go to the hospital? Again the same thing. She needs somebody to talk to her in a sympathetic way, care her. This is what her extreme desires. When this is not happening, she is getting a disease. So this came back to when, but she's doing everything. Why? What's the need to do everything to the daughter and the family when she's not getting the care? This is like people will talk bad things about my family. If I didn't take care of my daughter or my husband or family, they will start blaming me for not taking care of it. So I will continuously think about that blaming, not taking care of. So this consolation is what she needs. It will like I will take care of you. Don't worry. I will be there for you. So I need that consolation. When I'm consoled, I feel very happy. I wanted my daughter to ask me these things. She wants to take care of me. I want those kind words. This is what her need is. And this is one area. And the next area is the stressful moment. She told that in-laws have not cared me. I have done so much of work, but I accepted everything for the sake of my children and done all the hard work. But still, my daughter, after doing all the work, she is not taking care of me. And this itching is so much of bothering for me. This is like an insult to me. People will think of me disgracefully when they look at this. In another incident, in a continuation, they told that they won't allow my grandchildren to come to me. Then I started feeling very bad. So if their parents are not allowing my grandchildren to come to me, they say a simple word, "Don't go there, don't go to your grandma." Then I will be very stressed and I will feel so disrespected. A small word can hit me. A small things affect me. Small words. She said, "Rosha Mandro." So small words is very sensitive for her. She gets very angry at the time, but her expression is it's not about that great anger expression. She said that anger will last only momentary, only small time. And she said, and the experience in this anger, his whole body is very painful and her hands started shaking. She didn't tell it's trembling, but I can observe that her hands started shaking. She also continuously said that I had never expressed anger. I will become silent. I will cry immediately. I know only to cry. That is only thing that consoles me. Whatever anybody says, I started crying. This in anger also, she had never expressed that anger. She will silently go and do all the work and go and lie down. And here also the same thing is again coming. If I didn't do or if I tell somebody that this is happening in my family, they will insult me. They will think bad about my family. So this also the same thing is coming again. And its nature is, she told me that if she's also talking in a with a very smiling face and very bubbly. And she told, if I see a person who is very soft and with a smiling face, I gently go and talk to them. But if see somebody face is like harsh, I never approach him. So there is a need for softness, soft people, kindness, sympathetic people in her. And the generalities is the more desire for sweets, aversion, meat, thirstlessness, less than 1 liter per day, and her sleep position is on back, hands above the head. And thermal is she can't be without fan. Her attenders also confirm the observation. The thirstless, the better in the open air. She always want a fan, intolerance to heat. And attender also confirm the dependency, hypersensitivity, and need for reassurance and conservation. One more fear, she told her attender informed that she has fear of snakes. Whenever they show a video or image of a snake, she started speaking and shouting in a different kind of language, started shivering, and she ran away from the place. But patient told there is no fear. This is some attendance confirmation. So clinical summary is she is having chronic severe pruritus in the both feet more than 2 years with a maintaining cause of moisture exposure and sleep disturbances 12 to 2 a.m. The challenge that has been faced by many homeopaths in prescribing these cases, it is a pathology dominant presentation, mostly the individuality. They couldn't get her individuality because this was got after a multiple exploration. There is also a strong maintaining cause and a mixed emotional expression with functional endurance. So her mental profile is persistent feeling of being unsupported and uncared for. So this is weeping easily, hypersensitive to criticism, fear of social judgment is expressed. And after continuous exploration, her core experience of emotional abandonment, the need for reassurance, affectionate communication, clinging to a source of support, and fear of being left alone and abandonment. The reaction and compensation is from her. She is hurt with simple words. She started weeping. She withdraws and she starts clinging to some person. So suppressed anger and non-confrontational behavior. She never expressed her anger. Over responsibility and doing work for the need for care and comfort. And there is a partial compensation due to duty-bound endurance. Kingdom is plant kingdom with marked reactivity and sensitivity. Ranunculacea family, weeping, clinging, and emotional sensitivity. And the myosome is psychotic acceptance. With the analysis, with the withdrawal and clinging, the coming to the superclass 1 with marked sensitive in reactivity, plant kingdom, and the sensitive to harshness, hurt, sensitive to birth, weeping, consolation. With the shaky hands, we are coming to Ranunculacea family. Myosome is psychotic as she accepts, yields, endures suffering. Myosome is psychotic and have a level of experience is emotional level, and the remedy is pulsatilla nigricans. So this is the repertorial chart. Here the pulsatilla covers every rubric that had been entered, even in the skin complaints and her sleep and her fear of snakes and the constellation. And this is after 3 months of the treatment. Her cracks, as pus formation has never appeared after the remedy. And there is a reduced emotional reactivity and improved functional capacity at work. These are the repetition. 15 days after some past discharge record, so we give one other dose of pulsatilla, and the second follow-up we started with some mass reduction, but since 2 days there is an aggravation, so one dose of pulsatilla 200 aqua is given. And third follow-up, there is no medicines given. In the fourth follow-up, new eruption started, some sort of aggravation. So we gave pulsatilla 200 water dose for 15 ml for 15 days. So in sackcloth, and this is the final. After 8 months of treatment, everything is got cleared. Even the her normal skin started appearing. There is no pus formation at all. There is no recurrence. Everything got completely settled. So no skin eruptions and itching now. Emotional stability is improved. Reduced dependency behaviors and general well-being is completely improved. There is no suppression observed thereafter. So thank you, Swara Homeo Gurukul, for the opportunity. Thank you, Shekhar sir and the whole Swara Homeo Gurukul team. Thank you so much, sir.
Thank you, Dr. Sandhiya ma'am. So it was a nice presentation with good PPT. Thank you so much, madam.
Thank you, sir.
Now we will move to our next presenter, Dr. Manikanta S. Bevinakatti. He's from Bangalore, Karnataka. His years of experience of practice is 2 years. Currently fetching MD in medicine, final year from Foster Development Homeopathic Medical College, Aurangabad. Sir, you can present your case, sir.
Share that screen is visible.
Screen is visible. You make it full screen, sir. Full screen. Beside that, right side. Yes.
Yeah, myself, Dr. Manikanta.
No, it is not full screen, sir. Yes, now it is full screen. You can start, sir.
Yeah, this is a short case I am presenting here. This case is I am treated in my early practice. So going to case. This is a 35 years of male patient came with the complaints of the itching and burning of both the palms since 2 years. It is on and off. Before this, he took the treatment in various hospitals and local treatment also. And along with this main complaint, there is a sore irritation and belching on and off since 2 months. So when I go to his chief complaint, as this patient is from rural side, he exclaimed, "Sir, first it was the small lesion, so I ignored it, but slowly my skin became very rough and thick. And sir, I'm professionally driver and usually have to drive continuously. So due to this, my palms get start wetting, sweating. So for this sweating, I get usually I get intense itching, sir. During that time, this is I have to rub this continuously. So along with this, it is aggravated during bathing and eating, and during the winter season also. In this case, he mentioned the intense itching. So when I go to the intensity, so he explained this. Sir, whenever I get itching, I have to rub my palms on any hard surface until skin peel off. See, until skin peel off, and after that I get burning pain. Sir, because of this, I always keep one stone with me. So because in some places during driving also, I don't have to rub in any surface, so I keep the stone. So it relieves my symptoms, and then I continued it to tell me more. Uh, so uh, so he continued telling, sir, due to this, my mind became irritable and unable to focus on my work. Work means is professional work. Driving during driving also, me if we get itching and this these symptoms now, he can't. Okay, and I'm going to the local examination. So his palms look dry, thick, and rough surface, and fissures also I can seeing there. And while touching also, the skin also rough, and it bleeds occasionally. You can see here the skin is very cracked, and the rough surface also we can appreciating here. So, and both of the palms is affected, and this is second palm, so where the fissure is there one side. So when going to the case in detail, in personal history, this the claim for the sweet in general and aversion is nothing specific. Sleep is adequate, and the trust also small quantity of the water in long interval. The appetites also increased during this time, so drips is not particular. So and regular bowel and urine. So aspiration also scanty and scanty. So only on pumps. In this case, because of the rural layman during my early practice, the mentals are not so much uh, particular. So I'm going on this case, I made a totality. So by nature, patient is irritable in nature, and the concentration difficulty is there. Okay, here the presenting symptoms is qualified, so it has the particular modality, and along with the associated symptoms also I got. So the intensity of itching on both palm, especially it is more in sweating and in winter seasons, while scratching also is complaint is worse. Okay, and bleeding fissures also you can see here. So for irritation and belching, it is associated symptoms. So in general, sweet desire and scatic perspiration, palms, and thermally is chilly. So this only on this totality of the symptoms I repertorized. Here the main symptoms is physical rubric. This one extremities, eruptions, and on both the hands, itching and burning, and along with the intensity is itching more, and only the paucity of the mental symptoms only I got concentration difficult and irritability in nature. On this basis, I repertorized the petroleum is came, and I referred to so many Metramedica. In Kent Metramedica, so I got the general but on general rubric, I got these things and all, which I highlighted here. The intensity also marked in petroleum, and as we know, the petroleum sphere of action is on the skin only. So I prescribed petroleum 30 weekly one dose on the basis of the only fat level. So where the only I got modalities. So with this remedy only, so I got in second follow-up, after the 1 month, the intensity of itching is decreased, the burning pain occasionally, and a little bit fissures also you can is there still. the sore irritation completely subside. The skin became soft and generally is well. And you can see here before that he visit, only the one fissure is there remaining. And I continued the same, no any repetition, only on saclac I kept. So after the 3 month he came. So after 3 month, his the hands are very soft, and see you can see here no fissures is there compared to before slide. So this is the case where I not have the mental symptoms particularly, whichever the symptoms I have on the basis I prescribed. So where I get the result here. Thank you.
Thank you, Dr. Manikanta. So this was a case that tells us that in every case we don't need mentals. The symptoms which are present on that base, we can prescribe the remedy, and you were rightly used the repertory and references with Materia Medica. Thank you for presenting your case. So please stop sharing your screen, sir. So our next presenter is Dr. Vruti J. Kankotia. She is from Bhavnagar, Gujarat. Years of practice of experience is 3 years. At present, she is practicing at Swami Vivekananda Homeopathic Medical College as a medical officer and handling a gynec department. So with this, I welcome you, Dr. Vruti J. Kankotia, madam.
Thank you, sir. Sir, is the screen is visible?
Yes, madam.
Okay. There is a case of anxiety disorder. 45 years old female patient came with the complaint of constipation. I have a complaint of skin eruption on face, back, hand. There is a itching, redness of face. Redness is increasing during menses since 2 to 3 years. I have also complained of acidity, burning stomach since 2 years. If I drink a lukewarm water, taking cold things, I feel better. Spicy things cannot I cannot eat because of this. Complaints get worse. I have also complained of constipation. I go for the passing stool once in a 2 days. Bloating in abdomen, which is relieved if I do exercise. I lost smell after accident due to the brain hemorrhage at the age of 28 years. For this, I taken allopathic treatment since long time, but it cannot help. Tell me about yourself. Why are you so quiet? Because at that time the patient is not telling this that much. Uh, then she said, overthinking negative thoughts. Like patient said, don't want to take me with him. But she is talking about her husband. Maybe have an extramarital affair. Patient is feeling emotionless. What will happen? Family will destroy. Describe destroyed. Feeling mentally disturbed. Family will be destroyed. Describe destroyed. Feeling mentally disturbed. What will happen when your son is mentally disturbed? Then patient said he will frustrated, suffocating feeling, emotionally sensitive. His future will be spoiled. Then I asked, what will happen when his family is with him? Then patient said, he has a family, happy. His parents will stay with him and gives him love, care, support, safe feeling, stand beside him. I am with you and say I am with you. Then I ask, support in what way? Then patient tell emotionally, I am with you. Share daily routine things, talk with each other. Then what will be his experience? Feeling energetic. If support is not there, I cannot imagine my life without him. What about the dreams? The dreams of accident and because of her history of accident. After that, she get the dreams of accident, and generally she cannot remember any other dream. There is a weak memory, respect. She want respect. Sleep decrease due to the overthinking. The prescription of Gossipium 200 single dose and SLF BD for 7 days. There is a rubric mind whipping, tearful mood, mind brooding, mind restlessness, nervousness, mind anxiety, mind concentration difficult, mind thought persistent, face freckles, sleep restless, dreams unremembered, skin eruption red and dark. Then after the follow-up, there is a she feels the sleep is decreased. There is positiveness, no overthinking up to 60%. Again, I repeat the SL for the 15 days. The next follow-up, sleep is better. There is no overthinking. I am thinking toward the positive thoughts and all. So I prescribe the A3GQ mother tincture for 15 days and give the dose of Gossipium 2 packets SOS. If there is need, then she can take. The third follow-up, better in overthinking, mentals better, better in constipation, sleep is normal, no smell is still absent. I again continue the SL. The next follow-up, better in mood, no overthinking, constipation is also there, but it will be reduced by exercise. Again, I prescribe the SL and she is going on SL for last 2 to 3 months and she get better and now she is telling that I have no the overthinking and no negative thoughts. I am going toward the positiveness in my life and I'm happy chirpy girl now what I before. Thank you, sir.
Thank you, madam. So it was nice presentation with rightly follow-ups. So there was question in chat box that what is A3GQ?
Sir, A3G2 is a combination of ashwagandha, Avena sativa, alfalfa, and ginseng.
Okay.
In equally manner, 5 ml or 20 ml.
Okay. Right. Thank you, madam.
Thank you, sir.
So now we will move to our next presenter, Dr. Gayatri Gondale. She is from Nagpur, Maharashtra, India. Years of experience of practice is 2 years. She born and brought up from in Nagpur, completed BHMS from PHMC, Kamgaon, master course from the Other Song Academy, Mumbai. Worked with Dr. Shekhar Algungi sir for 1.5 years in his Andheri clinic. Now she has her own clinic in Nagpur. With this, I welcome you, madam.
Thank you, Dr. Bhanu. So this is a case of apprehension, fears, and acne. So this female is 52 years old, a CA final student. She came to me for major issues of acne on her face, mainly cheeks and forehead. And she also had stress headache. She had fear mainly of making mistakes during the work. So I asked, she told me the three things. So I asked, what troubles you the most? So she said, office work. I feel it's like a burden and then leads to stress, which in a way increases my headache. So I asked, what is stress about in that? office work. So she says ki works come on and I do a lot of work, but I did mistakes while working. And then I started self-doubting about the work because I did some mistakes and I kept on repeating the mistakes. So I asked, what will happen if you make such mistakes? She said, no, nothing will happen. Boss will say something. But actually, I am fearful and hence I make mistakes in every small work also. So I said, what is the fear mainly about? She said, again, mistakes. So she said, before doing any work, I get negative feelings. Suppose someone asked me to, this was the example she gave that, suppose someone asked even to make a tea, I will either spill it or I think that it will get spoiled. So I said, so what? So she said, I feel bad and guilty about it. I feel like a downfall. That we learn from A to B to C. These are the steps we go from A to C. But then when we make mistakes, I again go back to A and I cannot grow then. And I want to reach to a level that I should accept that there are solutions to things and I need to adapt to that. So, so I asked her, what will someone face in the downfall? So she said, thoughts will increase, there will be self doubts, practical thinking and planning will be gone, and confidence will be reduced. So, this all leads to productivity, which this all leads to a decreased productivity. So I then asked, imagine someone doing same mistakes in the office again and again. So then she said that person will not learn new things, will not get new work, and other person will not gain confidence on you that you can do this work properly. So then they will use you like a stepney. So I asked, what is a stepney? Then she said that you cannot grow and you will be given a work of very less importance and big work not will be given to such a person. And boss will taunt that you are such a coward, you cannot do smallest of the work, and it feels like torture to me. And because he is taunting, I cannot handle the situation, I cannot face it, and I cannot answer him back because he will feel that मैंने तो छोटी सी बात बोल दी, ये तो उस पे भी मुंह फुला के बैठ जाती है. This was her expression in Hindi. And she runs home when things get overwhelmed. She had a lot of homesickness. So her fears were basically, she used to get startled easily. Even someone coming from a distance, she used to get startled. She had fear of darkness, of dogs, stray dogs, and crossing road. She said, I asked, what is the fear in crossing the road? She said, someone will hit and run and I will be broken. My hands and legs will be broken. And she is very scared of accidents. So the details of her headache were, the headache was hammering type. It had heaviness sensation and it was one-sided, which goes from eyebrows to temples. And especially headache came after the stress of the office work. So she feels she will become unconscious with the headache and she sleeps in a dark room during the headache episode. Also, the acne, she had burning pain in those pustules. There was throbbing pain also, and it was red as shown. These are her pictures, and there was suppuration in the acne. Her nature was hurried, worried, and she tries to walk fast and eat fast. She is my distant relative, so I saw her very nearly, so I know all these things, and drives her vehicle very fast. So, an instance where I observed her panic, she was panicked in the case when she had menstrual issues later in the case. And I asked her to take a simple sonography report, but she was reacting like a kid. No, I don't know. She had a history of PCOD, and she was like, I don't want to go back to the same situation of my PCOD and all. So she was reacting like a kid that no, you what have you done and all that, and she was very panicked. So the understanding of the case goes like there is a black and white theme in the case wherein she has fear of dark, and the contrast of it that she sleeps in dark during the headaches. Then there is sudden and violent theme that she gets panic very suddenly and it feels torture when the boss yells at her, and there is a hurried nature and accident and startling Then homesickness, then fears of dark, stray dogs, accidents, making mistakes, and headache type, then burning pains, throbbing pains, and her likes in the food were fenugreek, potato, and tomatoes. So I considered the rubrics: mind, home desires to go, home talks of, homesickness, hurry eating while, hurry movements in, hurry walking while, fear animals of, dogs of, fear dark of, started right from approach of others at, thoughts persistent, thoughts rush off, mistakes makes, work in. So all covered, these were the mental symptoms, all covered by belladonna. Again, I took a sectional totality for her physical complaints of acne and headache. All were covered by again belladonna. So there, this is the understanding of plant kingdom, because there are no issues of me versus you. She is very sensitive to the things happening and surrounding her. There is a very acute miasm, because every thing which is happening with her, she feels threat from it. That my boss is that feels like a torture when he taunts on very small things. And this understanding goes to Solanaceae plant family. Sudden violent attack, sensitivity to black and white, fear of sudden death, fear of accident, etc. So belladonna understanding is, belladonna is a plant family of acute miasm. The main feeling of belladonna person is of a sudden threat from outside, from which he has to escape in order to survive. So the escape she used to do was, she used to go home when things got overwhelmed. And one of the belladonna patient, this is from Shankar and Soul of Remedy. So sir has put up it as the patient that I had, one of the belladonna patients that I had disappeared from the treatment suddenly, and after months suddenly called me up for some part of the world and then disappeared for months again. So this is how the belladonna behaves in the clinic. So then the prescription was belladonna 30 twice for 4 days, followed by SL. 30 was selected because her skin complaints were troubling her. There was a lot of burning and throbbing, and I thought it should not aggravate, so I gave 30 first. Uh, so first follow-up, after 2 weeks, acne was not improved to a good extent, but her mentals were improved. So she said she is in a better place. Her fears reduced. Stress was not there, because she was able to match her sheets wherein she was making mistakes. This is the WhatsApp chat. It is in Marathi, so I am translating it. She was able to match the sheet numbers, and which were not matching before. The tendency to make mistakes also reduced, and she could figure out where she made mistakes. And again, plus point where um, she got a big project to complete from the boss. Now that was a happy moment for her. Then for her acne, now mentally she was better. For her acne, I tried belladonna 200 single dose. So in next follow-up, there were no pustules on her face. These are the pictures of her from the next follow-up. Her skin improved to a certain extent. The burning, throbbing was reduced, and mentally she was again better. So I waited. I gave her SL. So after another 2 weeks, her skin started becoming greasy and oily, and I prescribed Thuja as an anti-miasmatic based on the skin and other complaints also, generals. So I gave Thuja 1 m, and later on the greasiness and all reduced, and pimples were reducing, but the scars were remaining. So the nature of belladonna being a sudden remedy, she stopped the treatment in between and she left. Because her periods were also not coming, that I asked her to take a sonography, and she used to get panic because of it. And again later on she left the treatment, and she went for the dermatologist when I asked her. So, but her mentals were improved with the remedy, and she was doing better. So this was the case.
Thank you, madam, for your presentation. It was nice presentation with PPTs and repertory, material medical reference, and follow up. Good
Thank you,
presentation.
doctor.
Thank you so much, madam. So our next presenter is Palmar Dipikaben Chimnalal. She is from Ahmedabad, Gujarat. Years of experience of practice is 5 years. Dr. Deepika, she did PG scholar and pursuing MD in Department of Homeopathic Repertory at Ahmedabad Homeopathic Medical College and Sainath Hospital, Bhopal, Ahmedabad. She also obtained a postgraduate diploma in hospital administration. She has worked as a homeopathic doctor as well as hospital administrator. Previously also, she has presented posters on topics role of silicea in interstitial lung disease, future direction of Ayush system research and strategies for transitioning homeopathy to main healthcare. She has published a few review articles and case studies in homeopathy with Homeo Miracle, Vital Informer, Homeopathy 360. With this, I welcome you, madam.
Hello, good evening, good morning, everyone. My name is Dipika Palmar, and pursuing my MD from Department of Homeopathic Repertory and Case Taking from Ahmedabad Homeopathic Medical College and Sainath Hospital. My today's topic is role of individualized homeopathic medicine in cases of uh, sorry, autoimmune diabetes, inflammatory bowel disease, and ovarian cyst. Autoimmune. Just give a brief about autoimmune disease. Then autoimmune disease are the group of disorder where the immune system mistakenly attacks the body's own organ, leading to damage. Then its causes are unknown, but the factors like obesity, hormonal changes, genetic disorder, aging, viruses, bacteria, they are the factors which cause the autoimmune diseases. Next one. There are some examples of autoimmune disease are celiac disease, dermatomyositis, inflammatory bowel disease, SLE and type 1 diabetes, multiple sclerosis, pernicious anemia, and others are the symptoms of autoimmune disease are joint pain, vision impaired, hyper or hypoglycemia, fatigue, weakness, swelling, erythema of skin, and other. If it may affect the one organ, then it is like type 1 diabetes, and in other multiple organs, it may be like lupus. The mechanism involved in autoimmune disease are innate immunity and adaptive immunity. So, in brief, I will like to describe my case. My case. Please, next one. Innate immunity. The factors are here. Next one. Adaptive immunity, the B cells and T cells are T lymphocytes are helping through the cellular immune responses and provide long-term memory. Next, these are the genetic, environmental factors, cellular mechanism, tissue damage and chronicity. Now the next. The tissues affected in autoimmune disease are blood vessels and red blood cells, skin and connective tissue, endocrine glands and joints and muscles are most likely to affect in autoimmune diseases. Now this is my case. On date 26 June 2023, a 37-year-old female patient came with a complaint of greasy stool, which is alternate with the constipation, and she is so much in stress and food like taking food from outside and colicky pain in abdomen. She has symptoms like forgetfulness, absent-minded, weakness. Next one, and weight loss since 3 to 4 months. There is increased frequency of urination, burning, itching present, craving for sweets, and desire for spicy food. Even every morning she has a mucus in the stool. These are the reports from which we can diagnose her type 1 diabetes. These are the menstrual history. She has a one child and LSC has done in history. Her menarche at 12 years. Menses are irregular, cycle also irregular. Leukorrhea and bright red with weakness and giddiness. Physical general, there is a thirst increased for chilled water, acidity which is decreased by milk. Then okay, there is a urging for fast stool and soft greasy stool. Mental generals. In mental, she is somewhat fastidious, like to work over and all. She like to work in any circumstances, and she is a gloomy, depressed, obedient, calm, angered, but she is like introvert and doesn't react to anything. Next one, like cooking, reading, writing, her creative, all matter, all level. One thing I saw that and she is suffered from mental trauma from mother's death, but she has some bias that she cannot save her mother's life. Next one. Systemic examination and general examination I found not specific, but in GIT, stools greasy and increased frequency of urine. Next one. So from analysis and evaluation, constipation alternating with diarrhea food from physical general, absent-minded mental general, mood disposition melancholic despondent, then fastidious need perfection. Next one. Rubrics taken are fatty degeneration. I will show you the evidence that sonography USG of abdomen and that suggests that fatty liver of fatty degeneration of liver, rectum constipation, diarrhea, rectum, food fat from, absent-minded, forgetful. These are the rubrics. Next one. Next. Next. These are the repertorization sheet. Here arsenic is not mentioned because she is not restless like. She is having weeping tendencies and all, and she can cry like sobbing, and introvert. She doesn't speak to anyone or as like she doesn't have changeable moods and all this. Again, she has come. This Ignitia 200 dose, single dose is given. Next one. In 13th July, she comes again, but there is a menstrual flow, partly fluid-like, profuse gushing. Flow appear on weeping. Consolation aggravates her. So again, the duration of Ignitia is 9 days. So again, I prescribe Ignitia 200 single dose. She is showing that in USG abdomen. Afterwards, I will show you. She has complained of mild dyspnea, headache, partial fluctuation in blood pressure, blood sugar. Sorry, forgetfulness, vertigo. Next, please. On 20th Feb 2024, she came with leukorrhea severe that stains for a long time, and so I found some tissue salts that covered in diabetes, that is natrum salt and califos. For 3 months I have prescribed along with the medicine. Next one. She has some keynotes of case that leukorrhea white of egg like slimy after every urination along with diarrhea. So on therapeutic measure, I prescribed ammonium mute 34 globules for 3 days and continuation of natrum sulfate and califosforicum for 3 months. Okay. So after hepatization, again I found lycopodium is one of the well followed by ignatia. So the similimum gets the better administration of similimum, patient gets better. Next one. Her complaints decrease. She has concentration problem, inferiority complex, leukorrhea. This is the 2023 report that suggests left ovarian cyst, large bowel loops, and okay. Next one. Then again I have done sonography of her 2/10/2023. There is a large bowel thickened and edematous due to infective inflammatory etiology. Next one. So the infective etiology, it decreases. 12th February 2025, again I have done sonography of her, and there is a mark hepatomegaly and fatty liver and left ovarian cyst. Next one. So the 22 March 2025 that she has a hepatomegaly with a grade 1 fatty liver. Okay, then next. On this last consultation, she has all complaints better, and ovarian cyst also dissolved. Thus, it was just a screening was done that the ovarian cyst get dissolved at that moment afterwards. Next one. These are the totality of symptom. Next one. And the rubrics are taken from the next. Next one.
Ma'am, time up.
Okay. Just last. Next. Yes. Further one. I have mentioned synthesis rubric, synthesis, and Murphy's repertory, repertorization. Okay. Sorry for the. Any questions?
Completed, madam, your presentation.
Just one slide ahead you can show, please. Yes. This is a repertorial aspect of synthesis and Murphy repertory I have found in autoimmune diseases. Okay. Finish.
Thank you, madam. Thank you for your presentation. It was long maintained follow-up
Okay.
so that we can learn.
Yes.
Thank you so much.
But she is now totally healthy mentally and physically as well as.
Yes, that can be done with homeopathy only, madam.
Yes. True.
So now we go to our next presenter, Dr. Gowtham A. He is from Rajahmundry, Andhra Pradesh. Years of practice is 5 years. Dr. Gowtham is deeply committed and passionate homeopathic physician whose journey into the healing art of homeopathy began during his 3rd year of BHMS. From an early stage in his career, he devoted himself not just to learn remedies, but to mastering the art of understanding the patient as a whole. Since 2014, he has been actively participating in seminars and webinars under esteemed mentorship of Dr. Shekhar Algungi sir, refining his skills in classical case taking and individualized prescribing. He has successfully translated this knowledge into clinical excellence, earning first prize recognition for his case presentation at Swara Homeo Gurukul. With a strong foundation in both acute and chronic disease management, Dr. Gowtham approaches every case with dedication, compassion, and scientific clarity. He is presently focusing on autism, ADHD, and speech delay cases, where he combines patience, precision, and perseverance in treatment. As part of his humanitarian commitment, he offers free treatment for children affected by these conditions, believing that every child deserves an opportunity for healthier and brighter future. Through clinical practice, academic participation, and services, Dr. Gowtham strives to contribute meaningful to the advancement of classical homeopathy. With this introduction, I welcome you, Dr. Gowtham.
Thank you, Banu. Is my screen visible?
Yes, visible.
So thank you for introducing me. So this is a case of chronic eczema. She has been suffering from many years, almost 12 years, and she is professionally she is a doctor, working as an assistant professor in one of the private medical college. So I have taken her case. She is 36 years female. Professionally, she is a doctor working as in private medical college, and she's been suffering with chronic eczema. So initially, I started the case. The patient has been suffering from chronic eczema since 2012, and initially starting on the right ear and later on spreading below the left eye with itching, dry patches and peeling. She underwent for a cosmetic bleach, which in the affected area, after which the condition persisted for many long years. She previously consulted a senior physician and was prescribed natriuretic.
I request everyone to mute your audio.
And she's also having hypothyroidism since 2014 with recent elevations in thyroid levels, associated weight gain and marked dryness of skin. She experiences occasional gastric disturbances and has fear of eating outside food. Perspiration ameliorates her complaint, and she feels better after sweating. So then mentally she is sensitive to being ignored. Though she appears calm externally, her facial expressions reveal feeling offended, and she dwells on even small matters. She's so sensitive girl. She feels insecure in direct situations, fears being labeled as unfit, and tends to overthink continuously. She cannot tolerate rushing of thoughts, avoid parties and pubs since childhood, and distracts herself through social media and series, and also having concentration difficult. So this was the initial part of case taking. Once after studying the case, these were the things she narrated. Then I started the case. She reports being pampered by her parents and often feels like a new or inexperienced person in challenging situations. So I asked, what bothers you the most? There shouldn't be any embarrassment. I feel embarrassed and that embarrassment continues. I don't like going to classes, especially to visit final year classes. I get irritated. So her main issue was that feeling of embarrassment. What do you mean by embarrassment? My question was, if I don't perform well in class, I get irritated. And if I am confident, there is no problem. But if I am not confident, I feel embarrassed. So how does it will be at that moment? I feel like I am giving wrong information. I feel weak, I have palpitations and think I am not performing well. What if you are not performing well or giving wrong information? I feel like I am misleading them. I get a cringe feeling and a feeling of embarrassment. So how does the cringe or embarrassment feels like? I feel weakness, palpitation, total loss of energy, no energy at all, and uneasiness, as if there is no energy inside my body. Can you describe that weakness more? I feel a drawing type of pain in my legs, especially in my thighs, total loss of energy. What kind of dreams do you get very frequent? So this was the first area. Then the next area, I probed on dreams. Dreams related to what happened or what I heard in the morning. Dreams of undressed, and many people are sitting and I am bathing in between them. Do you get any particular recurring dreams? Yes, dreams of being undressed in public. Can you explain the dream in detail? My question was, many people are present and I am without clothes, walking or bathing among them. Which part of the dream affects you the most? Thinking why I am without clothes. So, how did you felt in the dream? Embarrassed, shy and worried that people will remember it and comment on me. So, how does that embarrassment felt like? Sadness. Experience of being embarrassed physically, shivering, a type of weakness, cannot even walk, no energy to walk, cannot even eat due to weakness. So, two areas we have got the feeling of weakness and energyless. So what is the opposite state of this condition? It is being of lively, happy, contented and full of energy. So how is your sweating? Sweating relieves complaints, but occasionally she sweats. Normally she is so chilly girl, chilly patient. So based on the above case taking, I have repertorized mind, embarrassment, ailments from mind, confidence, want of self, offended easily, perspiration, amelioration, weakness, concentration difficult, sluggishness of body, eruptions, eczema, thoughts persistent. So based on the repertorial chart and based on her experience, I prescribed graphitis. So graphitis, Shankaran sir, soul of remedies, what he says that graphitis patients are timid and lack of self-confidence. They are cowardly, irresolute and are always doubting themselves. This creates in them an anxiety. They are dull and cannot concentrate. So based on this information and based on data given by patient, I prescribed Graphitis 31 dose followed by SL. After taking first dose of Graphitis 30, she developed immense headache, which was very unusual to her. Then later on, after 1 month of using medicine, I had taken a follow-up. In follow-up, since from many years she was suffering, within 1 month of medication, she felt better by about 50%. 50% better in her skin issues, and her state of mind is also calm and composed. And after giving Graphitis 30, she started taking classes without skipping any class. That was the beauty of this case. And after 1 month of again prescribing SL, on 25/7, again she came with severe headache. Again, 1 dose of 30 Graphitis water dose was given, and she's totally fine. And have been taking follow-up for the past 6 months, and she's doing very good. And you can see the eruptions. Previously, it was she was keep on scratching them. It was chronic, almost nearly 12 years. So within 1 month of medication, she felt very better. On the two sides of neck, she was having these complaints, and within 1 dose of Graphitis 30, she did very well. Thank you for giving this great opportunity, Swara and Swara team.
Thank you, Dr. Gowtham. It was a nice
Thank you,
presentation.
ma'am.
You have utilized areas very well, and not only that, you have applied these areas into repertorial chart.
And this case have taken hardly 30 minutes. Many say that practicing in this method takes lots of hours. Nothing like that. Even in village clinic also, I take hardly 15-20 minutes. I can finish one area within 20 minutes, and we can prescribe very confidently. So
Yes,
practicing in this method from my early starting of practice and gives immense results, especially in skin diseases. Thank you, Shekhar sir, for giving this great opportunity, and Priyanka madam for creating this largest platform of SODP and keeping connecting with us. Thank you, everyone.
Yes, we can see in your cases all your dedication of learning. Thank you so much, Dr. Gowtham.
Thank you, dear.
So our next presenter is Dr. Dhruvin. He is from Surat, Gujarat. Years of experience of practice is 2 years. He had started his practice in the initial days of BHMS only and started treating acute cases. And he was connected to Dr. Shekhar sir from his 3rd year of BHMS. Attended almost 4 to 5 workshops of Swara Homeo Gurukul and get trained under Dr. Shekhar sir and Swara team at Mumbai, Swara Homeo Clinic. So I welcome you, Dr. Dhruvin, with this introduction.
So thank you, everyone. Myself, Dr. Dhruvinsinh L5-S1Disc. Let's begin with our Guru's blessings. Without them, there is nothing. I am not at this stage without these three, all of them. Okay, so a case of L5-S1Disc bulge of paracentral disc extrusion and severe spinal canal narrowing. So this is the case of purely pathology based case. And you can see the pathology, this L1-S1 disc, which leads to extrusion and bulging. And due to this pathology, result in lower limb pain, numbness, difficulty, prolonged standing. This is the MRI of lumbar spine. Okay, this is a case summary. The extrusion is lead to severe spinal canal narrowing. With that, orthopedic doctor advised to immediate surgical management because there is no scope with painkillers and all. And he is the dentist by profession, so his job is to stand for 30 minutes, 1 hour, and 1.5 hours. So it was very difficult to him to even stand more than 2 minutes. So first I explored the LSMC, the type of pain, what are the sensation of pain. So needle type of pricking of pain. And what are the modalities? Morning gradually decrease and progress by the evening. And due to this, his work is too much affected because he is not able to stand more than 2 minutes. And further exploring the another areas, the areas coming of incapability in both and financial and physical fulfilling all needs of family without financial strain. So with this quality of some, at some point we are feeling like a mineral kingdom. Then after exploring, he's very much fond of luxurious lifestyle. He very he having tendency to show off of things. So when asked about describe the show off and what is the need to show off, he tell proud moment. So after exploring the proud, what is proud moment to him, he said happy and stable life because I have faced multiple accidents in my life, breakup of engagement, divorce, father imprisonment. So due to this accident, I need to show off or proud moment. This was the scar. His divorce, he feels as a scar. So after exploring about scar, tell me about scar. Experience was shocking, particularly because this incident never happened before in my life. It was difficult to accept. So later on, describe about shock. The shock is unexpected, without my any expectation, like caught by police riding in a triple seat vehicle, and the policeman put it in your jail. This is unexpected. They can fine a challan to you, but they will not put you in jail. So tell me about unexpected. So unexpected, he give an example of 5 year of long committed relationship with his fiancée. So he's completely trusting on her and taking a granted. Then he started affair with another girl because he having the back of me idea and back of mind, this girl will never leave me. So after that girl leaves him, it was severe emotional shock he described. Everything turns upside down. This is the major accident of my life. And at that time, he manifests a seizures due to end result of this. So I asked within fraction of moment, what was your state? He again tells perspires and shocked. Describe that shock. Feeling something come up across our and mind is not able to accept. This is shocking, completely unexpected. So after exploring unexpected meaning, something which is not predictable, like someone's death. We are talking with some healthy person, and after 2 hours we get no his news that he is no more. This is unexpected. So even his girlfriend's breakup is very much emotional breakdown and shocking for him. After exploring what is the reaction in that shock, there is numbness, no action and reaction. He was unable to understand what is happening. He kept thinking how it is possible, even feeling it is a prank. मतलब ये नहीं हो सकता. He was not able to accept. With that physical symptoms as perspiration, trembling of hands, legs, blurred vision, inability to control himself, body is not responding despite of will. This is the very most characteristic symptoms of his, because he said I am not able to type with my girlfriend during while he said our relationship is no more. I need to sit in chair. My body is not responding to mine, and complete looseness, numbness, and loss of control of my body. So case analysis, we can find it is a plant kingdom, clearly plant kingdom, where we can find shock, unexpected imaging. The shock is so sudden, so unexpected that he lead to seizures. And also he was on antidepressant pills from long time due to these incidents. So it is clear that it is a plant kingdom. So we can say we can see the Loganaceae, sudden shock and disappointment ailment from let down. The active and passive reaction we can see paralyzed, shattered, ailment from disappointment. So sub kingdom we can see a Loganaceae family. We can see a clear-cut indication of Loganaceae family as everything was unexpected, not ready for it. Imagine she can't do it with me. Like my girlfriend will never leave me even in dream, but still left me. This is the so sudden unexpected. We can compare it with Umbelliferia family also, because Umbelliferia family also coming with the Loganaceae type of shock. But what is difference? Main difference is in Loganacea, there is disappointment. Disappointment dictionary meaning something we are expecting in life, which is not fulfilled. So in Loganacea, we can have some expectation, like my girlfriend will never leave me. She is with me for lifetime. This is his expectation. But due to his girlfriend leaves him, he went into shock, which is Loganacea. In unbelief area, Sankaransan give an example of rape, accidents, which is no one can expect. This is the difference of unbeliever in Loganacea. So miasm is psychotic miasm. I ask what you done at that time. I can't do anything. I call my friend. I talk to my parents. Even he was insisting his parents to convince her. He can't he can't do it with his own. So this is the clear-cut psychotic miasm. With the repertory, we can take company desire for company alone while aggravate anxiety but future confusion of mind, stupor, will loss of, muscle refuse to obey the will. The very strong rubric of this case is from reliable repertory covering only 5 medicines. And we can see gelsemium is coming through and through with even in repertory with covering Loganacea family, psychotic miasm, and all. We can take materia medica from Allen's keynote, complete relaxation prostration of whole muscular system with entire motor paralysis. Okay, so prescription is gelsemium. After first follow 80% is improvement. He can stand even for 1 hour during his work. He is mentally feeling very much good and also cut off the medicine of antidepressant by his own self without doctor concern. Pain numbness completely relieved with second follow-up. He is very satisfied with the recovery, and even orthopedic surgeon gets shocked. He also went in Loganacea, like how it is happened without any surgical intervention. After he goes to the orthopedic surgeon for the follow-up. SL is continue going on for the third follow-up. Everything is going very good. But after fourth follow-up, he stopped the medicine by his own self. Symptoms again relapsed. And he also developed erectile dysfunction. We also repeat the medicine gelsemium. And again, he within 2 days he get recovery from he get normal erections. And during the follow-up, he's narrated one incident with his wife suffering from schizophrenia. He pretended like he's not my husband. At that moment, the patient suddenly fall down on the floor with hysterical convulsion. He said, again, I felt the same shock. I fell down on the floor. How can my wife do this with me? So this is a clear cut, we can say, quality of Loganacea family with gelsemium, with weakness, numbness, and loss of motor systems. Okay, thank you very much to all of you for giving this opportunity to me.
Thank you, Dhruvin. It was a good case and well taken case and nicely presented with in detail explanation about whole case.
Yeah,
So with good follow up. Thank you so much.
Thank you, sir.
So our next presenter is Dr. S. Vinay Kumar. He is from Vanaparthi, Telangana. Years of experience of practice is 1 year. Dr. Vinay completed his BHMS from JIMS College. He is currently pursuing his postgraduate studies in pediatrics at JSPS Homeopathic Medical College. He has a keen interest in pediatric homeopathic practice and holistic child health care. So with this introduction, I welcome you, Dr. Vinay.
Yes, sir. Good morning, sir. Good morning, everyone. Sir, is the slide is visible, sir?
Yes, Vinay.
Okay, sir.
Yes.
So myself, Dr. Vinay Kumar. So today, before going to start, tribute to Dr. Master Samuel Hahnemann. Coming to case, my case is on contact dermatitis. So before going to contact dermatitis, we should understand the basic difference between atopic dermatitis and contact dermatitis. So mostly it will be occurring in the lower age, atopic dermatitis, whereas contact dermatitis we can see in the more common in the adult, and mostly it is due to any chemical exposure. Next, coming to case. So, 34-year female. Her education is BEd Tech. So, she got married, having one son and one daughter. So, coming to chief complaints. So, I was asking her, tell me your complaints. She started like small water bubbles were started in my hands in the past. Later, it turned into cracks since 1 month, and it is getting aggravated. It is getting aggravated in the morning. So I used to get the same thing in the school also. She was telling, and she told that's itself. Then I was asking her, okay, tell me about your school days. Then the patient said that school days, I don't have confidence, fear of teachers as they beat me. I used to be like, no one should beat me, no one should scold me. My school is very strict, she was telling. This was her complaints. You can see the cracks over here, and she was having dermatitis since 1 month. So she was having lots of fears, and while expressing, she was telling about the sneezing complaints she was especially having during morning time, especially 20 to 30 sneezings, and she was feeling little bit uncomfortable. I was asking her regarding that. Then she again told that if I take stress, I get acidity. I do very less work in the home. My mother won't allow me to do work. Then I was asking her about the stress. What is the meaning of stress? Then she told that family stress, sir. Um, then how do you take it? Then she told that if I tell you about the harassment, it would be like a full movie. She just jumped into another situation. Like I was asking, she was started talking about that. She was telling about the husband. It is better the husband to stay away from me. My life journey is very systematic, very disciplined life. But these people are completely different. I felt like I am injured due to them. Due to husband, she was having some issues. So I was asking her injured meaning. Then she told that I got bad due to them. I used to get little support from my husband. Family is very important now, sir. Even after marriage, mother, wife, children should be a priority to every husband. But I'm fine now. He got promotion and in his job. But I'm fine. She was telling about that. Then why you became bad due to husband, how they used to treat you. I was asking her how they used to treat you. Then she told that they treat me like eat the leftover food in the home. She was comparing it like that. Financially, I'm very good in teaching in maths. Even students used to come to me for the teaching even during evening hours. I was 100% happy in this life. I can start up school teaching, etc., etc. She was telling, and but somewhere I'm feeling that I'm feeling like I'm not stable enough. Then I was asking her what is stable means I have fear, like what might happen in the future, can I handle all those things. She told, and just she stopped again. Then I was asking her, okay, how they used to treat you. Again I started asking the same thing. Then they don't used to treat me equally. Basically I want to be very neat, I used to keep things very neatly. I have seen both good and bad phases in my life, she was telling. Then she was telling about the support she was getting from the family members during the first miscarriage. She told her first miscarriage happened to her mother-in-law. Then at that moment, she didn't treat her in a right way. So that is what she was telling here. It is not an illegal marriage, right? I couldn't realize they couldn't realize the value of me in their home. In that way, she was telling. Then I was just listening to her. Then she was saying that my sister and my mother was protected me like a shield during the days. That's it, sir. Nothing more. Nothing more. She was telling. Apart from that, can you tell more? I was asking. That physical levels got started. Everything is fine here. Thirst coming to thirsty, large quantities at a time. Hard stools, not passes daily. And dreams of school dreams she used to get. Desires bakery items, especially sweets. In chilly patient. Okay, and coming to perspiration, especially at the neck region and the head region, menstrual history, FMP is 12 years of age, and everything is normal over here. But during menses, she experiences pain in the thigh and the calf region. Coming to obstetric history, she has one abortion at the second month, I guess. Coming to past history, medical and surgical history, there is no medical and surgical history. Coming to family history, father is apparently healthy, he is having no health issues, whereas mother is having osteoarthritis and hemorrhoids. Coming to vitals, vitals are normal. By taking the whole thing, I prescribed her calcarea silicata 200, one dose. By taking the whole totality, I took, I prescribed her calcarea silicata one dose at night time. All these are different forms of SACLAC. So this is the repertorial totality. I have repertorized the case: cleanliness, manual for confidence, want of self-confidence, fear of dogs, sneezing, all those things are there. So lycopodium, Cilicia, sulfur are few remedies. This is from the complete repertory where I took skin chapping. So why have prescribed calcarea silicata? The calcarea silicata patients will feel insecure. They need protection like Cilicia. They are very anxious about their health, and they are afraid that what people will think, like whether I can handle my own business or not, and using the family for protection. And they are having sensitive to criticism, and in kids you can see that sensitive to reprimands, desire to be magnetized. And coming to follow-up criteria, after giving calcarea silicata, she was feeling much better by 80%, and you can see here all the eruptions went off, but only one eruption was remaining yet. Itching was completely reduced, but the eruption is there. And mental state, she was feeling much better. Physical generals are normal. And sneezing, previously she used to get 30 to 40 sneezing, she used to tell, but the severity got reduced. What I mean to say is the severity is reduced, and menstrual history is again normal. So I have prescribed calcarea silicata one dose in divided doses. I have prescribed it, and these two are SL in different forms. So the idea of mineral kingdom is like it is about the structure. What Dr. Shankaran sir used to tell that forming, maintaining, losing structure. It all talks about losing or forming the structure. So all these are a few words of mineral kingdom, like identity, position, relationship, security, performance, and responsibility. You can see here how it is well structured. So coming to our case, calcarea and silicata, calcarea from one row and Silicia is from another row. You can see here row 3 and row 4 idea. So coming to Silicia, you can see here in the row 3, Silicia people will be like, I am clear what I am. This is me. I have everywhere they will talk like I have a definite image, I have a specific identity. In that way, they used to talk like this. Row 3 talks mainly about identity and nourishment. And coming to row 4 is like security and task, more of security and task oriented. So you can see the calcarea is finding a lot of security issues, lot of dependent issues, support issues we can see. And at the so finally I'm ending up with this. I am very thankful to Swara Homeo Gurukul for giving me this opportunity, and thankful to sir and to every platform. Like I have studied in James Medical College. I am very thankful to my college, and currently I am doing MD in pediatrics in JSPS. I was very thankful, and I'm seeing my clinic. So what I say is shaped by great teachers, strengthened by my patients. And the journey continues. Thank you, everyone.
Thank you, Vinay. It was well presented case
Thank you,
with
sir. Thank you.
detail, and you also explained about the kingdom and everything clearly. Thank you
Sir.
so much for your presentation.